Did you know that heart disease remains the leading cause of death in Ohio? I'm here with Buckeye Health Plan's Medical Director, Dr. Peter Kambelos, to discuss why Ohioans should make their heart a priority. And Dr. Kambelos, thanks for joining us.
Happy to be with you again.
So why is Buckeye Health Plan raising awareness of heart disease?
Well, heart disease is so prevalent in this country as a killer of Americans. In fact, it's the #1 killer of American men and women. And in Ohio alone, we lose 30,000 people a year to heart disease. That's equivalent 1.5 times the population of Norwood every year.
Wow.
You know, when you consider that, it's pretty significant. So given the number of people affected and the fact that we can do something about these disorders to hopefully prevent, complications, that's why we're focusing on that, especially this month during Heart Month.
Absolutely. And so often people don't even know they have heart disease. But tell us, kind of go through what is heart disease?
Okay. So heart disease is a broad category. That's a general description of things that can go wrong with the heart. So the most common in the United States is coronary artery disease, also known as coronary heart disease, epicardial coronary disease. Essentially what that is a clogging over time of the arteries, superficial arteries on the heart that supply the heart muscle. Over time, those arteries, like old pipes, they tend to clog up. Usually it's with cholesterol plaque, and that can lead to reduced blood flow and perhaps even in the case of complete closure of an artery, death of that heart muscle and a heart attack. That's the most common. There are other very common forms of heart disease that we should probably touch on. Congestive heart failure is very common in this country. Congestive heart failure is basically when the heart muscle is not pumping efficiently enough to pump oxygenated blood that it receives back out to the lungs and to the body to supply those tissues. And unfortunately, that's also very common in this country. We also have arrhythmias, which are lumped into the category of heart disease. And arrhythmias are basically when the normal rhythm of the heart is interrupted, and it's an irregular rhythm or an abnormal rhythm that again results in impaired pumping capacity of the heart.
Yeah, so what should Ohioans be on the lookout for ahead of a major cardiac arrest? Because there's so many things that I'm sure there's symptoms, right?
Yes, and those symptoms are pretty broad again, and depending on the individual. Men and women have different symptoms, the elderly have different symptoms, diabetics have frequently different or atypical symptoms. But let's say some classic or cardinal symptoms of heart disease, could include chest pain, chest discomfort, discomfort in the upper part of the body radiating up to the neck, the jaw, or the teeth, or to the arms, numbness or tingling in the upper extremities, difficulty breathing, swelling of the feet or ankles, retention of water. Those are very, very common signs and symptoms. Dizziness, lightheadedness, palpitations, racing of the heart, unusual fatigue. And then individuals, again, the elderly, diabetics, it could be things like, very atypical things like upset stomach, nausea, confusion. So those symptoms are pretty, broad.
Yes.
And so the individual with any of those should really basically seek prompt medical attention.
Yeah, you have to really be in tune to your body too, I would imagine. So what tips can you give us to maybe help us have good heart health as we go about our daily routines?
Well, we can all make changes in our lifestyles that could improve, our lower our risk of developing heart problems. One would be to eat a healthy diet. That's one that would be rich in fruits and vegetables and lower in bad saturated fat, animal fat, Crisco, things of that nature. So lowering our diet in bad saturated fat, more fruits and vegetables, more activity, more exercise. Those who smoke should probably quit smoking. Those who have high blood pressure should control their blood pressure better. Of course, all of this with the assistance of the primary care physician. Diabetics should better control their blood sugar. Cholesterol readings, if one has high cholesterol, they certainly should, address those and get some optimal numbers there. So there are lots of things. Get more sleep, get reduced stress, multiple things that we can do as individuals, as patients, to reduce our risk of cardiovascular disease. And again, staying in touch with, seeing your physician, primary care physician, on a regular basis.
Yeah, and all those things are easy to say, but so much harder to do, right?
Yes, indeed, they are.
Those are lifestyle changes that we have to make. So how is Buckeye Health helping Ohioans when it comes to their heart health? I'm curious about that.
Sure. So, our motto, and I've said this before, our motto at Buckeye Health Plan is that our goal is to improve the health of the community one person at a time. And, once again, we sincerely mean that. We care about our members, we're invested in our members, and we surround them with lots of tools where we can help them help themselves. One example would be our care management program. Our care managers touch base with our patients with chronic health problems, such as chronic heart disease, help coach them along with their diet, exercise, some of the things we already talked about, help them with making appointments with their doctor, and even arranging transportation free to and from those doctor's appointments.
Okay, Dr. Kambelos, thank you so much for that information and helping us to stay heart healthy. And if you would like more tips, all you have to do is go to BuckeyeHealthPlan.com/heart.